Welcome everyone to our 1:30 session. My name is Tina Costa. I'm one of the directors with the Office of Virtual Health, hosting the BC Digital Health Forum, our virtual sessions again today. For those of you just joining this afternoon, please join us in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. Let us all continue to give thanks for the opportunity to gather, learn, collaborate, and provide care together. I now have the pleasure of introducing our next panel of presenters here. We have Dr. Beth Payne, Sally Chen, and Haneen Amhaz. Beth is the Digital Health Research Program Manager at BC Children's Hospital Research Institute and the Women's Health Research Institute. Beth brings together 15 years of research and leadership experience in the fields of global health and digital health focused on maternal and child health. She has published over 75 peer-reviewed publications and 2 book chapters and is passionate about the equitable use of digital technology as a transformative force in healthcare. Sally is the Digital Health Research Coordinator at BC Children's Hospital Research Institute and the Women's Research Institute. She holds a Master of Food Science and a Bachelor of Science in Food, Nutrition, and Health from the University of BC. She has experience in her previous positions ranging from managing national health projects to supporting a provincial public health project and to leading a municipal health and wellness program. Haneen is a Master of Public Health student at Simon Fraser University, currently completing her practicum placement with the Research Agenda for Perinatal Innovation and Digital Health project. Haneen's public interests revolve around maternal and child health, as well as global health. Haneen is also the winner of the student research poster presentation for the forum. So again, congratulations, Haneen. She presented on it yesterday. For those of you, it will be available and is a recording if you didn't get a chance. So please join me in welcoming Beth, Sally, and Haneen on their talk around co-development of a research agenda for perinatal digital innovation and patient and health systems partners. Over to our presenters.
Thank you so much, Tina. I'm just gonna share my screen, which always leads to a bit of an echo at first, but I think we got it. Thank you all for joining us today. We're here to present to you a project that was very collaborative that happened over the last year. My name is Beth, and I'll lead us off. So this project is sometimes called RAPID. We called it the Research Agenda for Perinatal Innovation and Digital Health. But before I start, I want to acknowledge that we work at the BC Children's Hospital Research Institute and the Women's Health Research Institute, both of which have their main offices here on the ancestral and unceded territory of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. But we do work across the province in all of our projects, including this project RAPID. And so I want to extend my gratitude as an uninvited settler on these lands to all of the First Nations across BC. So RAPID, as I told you, was a collaborative project with multiple partners from across the health system, but also with patient partners and clinical care provider partners. We all worked together to complete activities with these 3 goals in mind. So we wanted to identify gaps in the perinatal continuum of care that we could address with digital innovation. We also wanted to define barriers and facilitators to optimal adoption of digital health for perinatal care in BC. And finally, using this information, our aim was to co-develop research priorities, addressing these gaps and barriers, and motivate further digital innovation in BC. We had a multifaceted approach that involved many activities, as I said before, starting with a literature review, as you often do in research. The literature review focused on the barriers and facilitators that have already been published around access and adoption of digital health in the perinatal period. We followed that with a thought exchange with which anyone who was at the sessions yesterday will now be familiar with, Our thought exchange was specifically targeting clinical care providers to understand what tools are currently used in the perinatal period in BC, and also where perinatal care providers thought there were opportunities to improve digital innovation or add innovations that would improve care. And I realized at the beginning, I should have defined the perinatal period for anyone not familiar with this jargon. Perinatal refers to from conception through pregnancy and delivery up until the end of the first year of life for the baby. So we're really talking about care around pregnancy and early neonatal period. So once the thought exchange was complete, we worked with our partners at the Provincial Digital Health and Information Services and OVH, as well as Perinatal Services BC to review the BC Digital Health Strategy, which many of you are now familiar with, as well as the Maternal Services Strategy from PSBC, and to use those documents to guide us to identify where there might be opportunities that fit within that space of priorities and strategy. What we're going to focus on in the rest of this presentation is our patient engagement process, because this was really the core of the project. Our aim was to center our research agenda around the patient experience and the patient needs. At the end of the patient engagement process, which we'll explain more, we had a workshop where we brought together all of these partners, clinical care providers, researchers, representatives of the health system, and those leading the BC Digital Health Strategy and from Perinatal Services, so that we could build consensus around what these priorities were. Now, to explain our patient engagement process, I'll hand the floor to Haneen.
Yeah, so going into our patient engagement meetings, we really wanted to center patients within our project, and so we used a human-centered design approach. And this is defined by IDEO.org as a process that starts with the people you're designing for and ends with new solutions that are tailor-made to suit their needs. And so this type of research is often used to focus on the person as a whole. So this would include their situation, ethnographic, and physical environments. And so using this, it would ensure that patients are partners in our research rather than subjects of it. And it shifts the focus from what we think we know about patients to what their actual experiences are. And so this approach would allow us to build on the real needs, wants, and pain points of patients in order to develop solutions that are responsive, feasible, viable, and desirable. Next slide, please. And so the human-centered design process has 5 steps. The first step is empathizing. So this is trying to understand what they define as the target audience, which in our case is our patient partners. And so seeing what their preferences are, what works for them, what doesn't work for them. And then the next step is defining. And so this is coming to a consensus with, as researchers, but also with patient partners, what the problem is that we are trying to solve. And then further, we would go into the ideate process, which is generating as many ideas as possible to focus in on our objective. And then the next step would be prototyping, which is evaluating those various ideas that we had to determine what, to start generating those solutions. And then testing is testing those solutions with, again, they use target audience, which in our case was patient partners, in order to make adjustments. And so this process looks linear, but it's actually an iterative process. Slide that. And would typically look more like this, where you're going back and forth between the different steps just as your project progresses. But in our scenario, our goal was to come to a deep understanding of patient needs and defining those priority problems to address. And so we really just focused on using the empathize and define steps of human-centered design. And I'll pass it on to Sally, who will
Thank you, Haneen. So for this rapid study, we used the human-centered design and user experience activities to achieve our goal. As you can see on the table here, here's the outline of what we did. So we have 4 sessions, and each session has its own objective, pre-session activity, and session activities. And all of those activities will carry out on Miro, an online interactive workspace where patients can create, share, and manipulate visual assets in real time with others. So for example, here you can see activity we have conducted, including empathy map, user journey, insight statement, worksheet. Next slide. Thank you. And for this project, we looked for patient partners who were multilingual and pregnant, or a caregiver of a child under 2 years old. There were 15 respondents to our call out, and 4 were selected based on their diverse educational and ethnic backgrounds, experiences, and geographic location to ensure diversity. So in this slides, we are going to show you a video from our patient partners. To respect our patients' time, especially in consideration of being new mom, we have provided them with the option to send us pre-recorded video regarding their perspective on this rapid project. We encourage them to share their story with us, such as why you want to join our patient partner group, and what are your key takeaways from our weekly planning meetings and workshops, and what is your overall experience with us. Now it's the time. Let's now hear from them.
I just have to switch the audio over. Give me one second.
Hello, everyone. This is Kylene. I want to share my experience. I was joined as part of the patient partner for RAPI project. At the beginning, I was thrilled to have joined the RAPI project as a patient partner focused on identifying perinatal digital health research in BC. When I come across a project advertisement by Women Health Research Institution and the BC Children's Hospital, I feel compelled to contribute because having immigrated from China, British Columbia has become my second home. And I recently welcomed my first baby boy in July 2022. As a working professional and a woman, I strongly believe the digital health solution for perinatal care is so important to all the women in BC. So that's why I submitted my application, and luckily I was be part of the project throughout the weeks.
Hi, everyone from Digital Health Conference. My name is Lu. I'm a patient partner who joined the research agenda for Perinatal Innovation and Digital Health Research Project, which is the RAPID project. I am an immigrant from China and I came here about 18 years ago. I'm also the mom of a 6-month-old boy. When I joined the RAPID research project, my son was only a couple of weeks old.
Hi, my name is Jade and I was a participant in the research agenda for Perinatal Innovation and Digital Health Research Project. I was a member of the patient cohort of this study. I came across the open call for participants through social media. I was immediately interested in participating because I was pregnant at the time and had faced the challenges and accessibility or lack of accessibility to perinatal services across the board, BC. What also interests me about the study was the fact that it was intersectoral and it was including not only health professionals but also the patient's lived-in experience and the view of us as patients, which ultimately are the users of the services.
There are quite some reasons why I joined this research. Firstly, as it was my first pregnancy and being a first-time mom, I experienced some of the uncertainty I felt during this whole process. I think a lot of the things can definitely get better. That's why I participated in the program, because in the program, I was able to share some of those aspects that I feel this community is not doing enough to help new mothers like me.
I hope my involvement in this project will assist researchers and the developers in creating more effective healthcare tools I collaborate with project team Beth, Sally, Helen, and other patient partners. It was fun, and we go through several remote meetings. We engage in different type of activities every time. It's including empathy mapping, reflection, user journey mapping, and workshops to discuss priority research questions along other partners. We share a lot of our personal experience to the project team and discuss what's the challenges we are facing during the journey. I feel like this is mean a lot, and everybody's so open to share and open to listen. And it has mean a great deal to me to share my personal experience, as I believe many first-time pregnant women face similar challenges throughout the journey.
Speaking as someone who had experienced two cultural backgrounds as well as languages, I understand the confusion of a minority facing an unfamiliar health system. Perhaps my experience can also make the needs of the minorities being heard. After a couple of weeks of participation through meetings and workshops, also with each of our perspectives and insights that we could contribute, I learned that most of the problems I was facing were also what other moms are facing. There were some other moms who participated in the program also. I wanted to meet them and hear their stories as well. I want to see if they were experiencing the same struggles that I did and how other moms solve their issues.
Through the process, the research team led different activities and meetings weekly so that we could identify common themes which eventually would indicate a final activity where we met with the other cohorts of healthcare providers and narrowed down the areas or themes of research that will be included.
I think this project was undoubtedly been a resounding success in its approach to including patients like us. So definitely this project commitment to patient involvement and the emphasis on real experience and the challenges are key factors contributing to its success. I really believe this model for how patients engaged and this kind of thing can lead to more effective and empathetic healthcare solution. So I wish this similar project have achieved the same level of the success like us, and I really appreciate and be thanks for the healthcare team and a lot of people working behind it. So this really means a lot to all the women in BC.
Being part of this research program can help others better advance the digital health system in the future. I can use my experience to help more new moms to reduce their distress. I also see that many people are also working behind the scenes to make the health system more user-friendly and accessible. This gives me confidence that the community will become more mother-friendly in many aspects in the near future.
I felt empowered and I feel like my voice counted, which was very, very important because ultimately patients are the ones using these services. I really enjoyed how the research team was just there guiding and listening and synthesizing what we as patients had to say, as well as other healthcare providers, and how they were able to summarize the results and give it to us and also offer us the views of the other side, like the healthcare providers. I felt like it's important for patients to influence and inform the research topics coming up, and it makes you feel empowered.
At the end of the research, I was very glad to see what the organizers of the project had come up with several categories of research questions based on the content of our thoughts over the past meetings and workshops. these questions summarize what we have shared based on our own experience and what we were looking forward in the future in a very professional way. Thanks for conducting this research project, and thanks for inviting me as a patient partner. I had a very, very good time, and also excited to see the future of our digital health system. Thank you, everyone.
Yeah, so the process was really rewarding for us, just seeing how much the patients enjoyed it and how well it worked at creating discussion. And yeah, because we felt it worked really well and the patients also felt it worked really well, we developed a toolkit for other researchers in digital health innovation to use. And you can scan the QR code to see the toolkit, and it just provides an overview of all our patient engagement meetings and also provides templates to all the activities that we had.
Thank you, Haneen. And just like the patient in the video said, we have conducted a total of 12 questions and divided them into 3 overarching themes, as you can see here presenting in front of you. So the theme 1, we focus on around patient support and autonomy. And theme 2 revolves around educational resources for patients and provider. And theme 3 includes access of health information. So the list of the questions were then shared with patient partners and to gather their feedback and suggestions to ensure that the research questions were truly reflective of their needs, experiences, and priority. So for more details, please scan the code on the top right corner to view the full list of the research agenda on our website. Thank you.
So once again, I just want to acknowledge our amazing patient partners. It was an incredible team to work with, and our steering committee and the funder, Michael Smith Health Research BC. But of course, as you saw from Haneen's slide at the beginning, this is just the start of the human-centered design process. So we are actively looking for new team members to help us action the research agenda and maybe act on these research questions. So if you want to connect and get involved, please reach out to us. Thanks.
Oh, Tina.
I'm saying thank you. Thank you for letting me know I'm still on mute. Thank you, Beth. Thank you, Sally. And thank you, Haneen, for your work in this area, number 1, but also for highlighting the importance of patient advocacy right at the very beginning, before the research even starts. That's really incredible. Really a great example of how engaging thoughtfully with equity deserving groups, like you mentioned in this particular case, can drive us to improve care in a way that's most meaningful to them. Great to know right up front what they want us to do better and to be able to dig into it. So encouraging questions. I do have one that we'll start with. We've got a time for a couple if we can. Wondering from your experiences, I'm not sure who might be able to speak to this best, maybe all of you, but how different do you think the research questions identified would have been without patient engagement? What were the surprises for you?
That's a really good question. I think the nuance of the questions is a little bit different, and the focus on educational tools. I think for me anyways, particularly as a researcher, I think of more like active digital health tools and apps and things, and the patients wanted something way before any of that, like just to be informed. And one of the things that isn't specifically listed, because our questions are a bit more broad, but we'll be presenting a more fulsome report eventually, is that one of the challenges shared by all the patient partners was just in identifying a care provider. And so those are things way downstream that I often forget about as part of the process. So yeah, for me, that was one of the most interesting ones. Do you guys want to share?
Yeah, I think you covered the most important part, the caregiver, the care providers, what they are looking for, and they try to, have the two-way communication. So it's important to know from patient side, like what's your barriers other than just like make an assumption, like this must be their like barrier or difficulty. So we want to make sure that, start with the research by understanding what they are thinking from their side.
You, Haneen.
Yeah, I think just echoing what was already said, with them, it's often their first pregnancy and they don't even know where to start. And that came up quite a lot. It's like, we have a lot of questions, but you're not seeing a care provider immediately. Where do you begin? Where do you get that information? That was, yeah.
Wonderful. Have a question here. You teased a little bit about next steps. Can you share more about what the next phase of the human-centered design approach will look like?
Yeah, so each of those questions could really go into the next phase because there's lots of different topics now, and each needs to be really brought out in terms of the ideate stage. So you can't take the whole research agenda forward. So really our way of approaching it is we're trying to communicate these findings as much as we can, identify research teams that might already be working in this space and try to encourage them to adopt answering some of these questions or working with us and patient partners, looking for funding to build teams and answer specific questions. So it's a little bit of a mixed bag, but that's really how we're approaching it. So again, if you're doing research in this space and you're interested in some support, we're here and we'd like to help carry forward this work. So.
Well, really exciting. Loved the video and to hear the empowerment that you brought to your patient partners. Thank you for that. We will, just due to time, keep us rolling. And so encourage anyone to reach out to Beth, Sally, and or Haneen. Use the QR code if you were able to grab it to sign up if you're interested. And we will get ready for our next session. And so you'll see the Zoom poll pop up here shortly. And we're going to get ready for our 2 o'clock session, which is entitled Virtual Reality as a Potential Treatment for Individuals with Vaginal Insertion Phobia. So a bit of a shift in topics, but looking forward to it. Again, Beth, Sally, Haneen, appreciate your time. And Haneen, once again, congratulations.
Thank you.
Thanks, Tina.
Thank you.
Yeah.